everyone. This is Dr. Matthew Hernandez with Ethos Integrative Medicine, and this is Dr. DJ Saba.
Hello.
We're both sports medicine doctors here at Ethos, and what we're going to be doing today is showing you some common causes of shoulder pain. So one of the things that we have a lot of patients come in for is going to be shoulder pain, and the number one question that they have when they walk in and that they want to know is what exactly is causing my shoulder pain. We think it's a fair enough question to go ahead and answer for you all. So what we're going to do is go over some of the common things that we see in our office to cause shoulder pain, and give you some characteristics that these issues contain so you can kind of self-identify at home whether or not you have these particular problems. And then we'll show you some tests that you can do at home to get a better idea and confirm what we're talking about today. So when we're looking at shoulder pain as a whole, the way we're going to break this down is go and look at 3 different sides of the shoulder. So we're going to talk about pain in the front, pain on the side, and then pain in the back. And we use this because one, it's easy for you to go and say, I have shoulder pain here, and then we can go and talk about specifically what can happen in that spot. Now, we're not going to cover everything that, all the reasons you can have shoulder pain in one given spot, but we're going to give you what's statistically the most likely to be the case based on the experience that we have here. And then obviously if none of these sound like what you're experiencing, might be beneficial to go see a doctor and get a little bit more clarification on that. But we'd like you to be able to understand what you're walking into. So educating you on this part is going to give you a good starting point on understanding your shoulder pain. So for this first one, what we're going to start with is the front of the shoulder itself. So one of the common things when we're looking at shoulder pain is you can have pain that is in the front right here. Now, the first thing that a lot of people think of, and they're correct to think of it, is going to be having a biceps problem. So your biceps muscle is right here, right? It's the muscle that you get when you flex, and the tendon for that muscle attaches right here at the top of the shoulder. Now, one of the things that when people have pain here in the front, you can have a biceps tendon problem where the tendon, which is the tissue that attaches the biceps muscle to your shoulder, starts to get frayed. So think of if you put a rope on a sharp rock and you go back and forth, that fraying that occurs, that can happen to the tendon here. Now, the pain for this particular problem tends to be right here in the front, and when you activate your biceps tendon, it tends to cause a little bit of an issue. So the way that you activate it is we're gonna have Dr. DJ lift his arm up, and I'm gonna put some resistance on that. And usually if you have a biceps pain, it's gonna be right through here. Another way to test this would be to give, or to go and try and pick up something a little heavy. And if it's really severe, then you'll notice a difference here. So you might see some weakness when you're going through there, or you might have pain in the front of the shoulder. That could be a biceps problem. Now, the thing that we see a lot of that gets misdiagnosed as a biceps issue is actually your AC joint. So your AC joint is your acromioclavicular joint. So the acromion sits here, your clavicle or your collarbone runs right here, and where they meet up is your AC joint. That looks very much like a bicep tendon problem. So you can have pain, again, directly, it kind of goes in a straight line in the front. And when you have that, that's usually because there's some damage to the AC joint, and the damage comes in 2 places. One, if you have the AC joint, so let's say this is the acromion, this is the clavicle or the collarbone, what can happen is when you lift your arm up, it can kind of butt up against itself. That can cause arthritis in between the joint, where normally it's supposed to kind of move like this. And then the joint itself is covered with a ligament. And when that ligament gets overstretched, that can actually cause a lot of some instability in the joint, and it can cause pain as a result of that. And so both biceps and AC joint have pain that goes directly in the front of the shoulder here. And again, you can experience both at the same time. Like you can have a biceps and an AC joint problem. But I'm telling you about the AC joint because it's one that we have a lot of people come in to our office and they were misdiagnosed with some other issue, biceps typically, and we found it was the AC joint. The way to check if it's an AC joint would be, you could do a few different things. So one is you can have your arm lift out by your side. So go ahead and go straight up. And usually if you have pain right at that 90-degree mark, so right here, so 90 degrees, when you have pain right here and it's on top, that's usually an indicator that's an AC joint problem. The other thing that can be done is you can go across here, lift your elbow up, and then have someone push down on your elbow. If they push down and it's causing pain up here on the top of the shoulder, it's your AC joint. So those are two ways that we can go and check for that. And then, from there we have an accurate diagnosis and we can go about treating this. So that's the front of the shoulder here. The next thing that we're going to look at is going to be the side of the shoulder. So usually when patients say, oh, I have shoulder pain, it's right here, and they point to the side, a lot of people will go and think that this is a deltoid problem. Your deltoid is this muscle right here. What this tends to be more often than not is going to be a rotator cuff injury, and specifically to the supraspinatus muscle. So your supraspinatus muscle runs back here and it attaches right in this spot. What can happen is that tendon can get frayed. Think about what we said earlier, a rope on a sharp rock. You go back and forth. That fraying that occurs can cause a supraspinatus, it's called supraspinatus tendinopathy, where the tendon is getting damaged and it's causing pain to go down the side of the shoulder here. Now, and sometimes this can even go all the way to the elbow, but most of the time it's just in the deltoid. People will get massages, get cupping, get dry needling, all those things in the deltoid thinking that's the problem, and it's not. It's an issue at the rotator cuff. And so when we're looking at that, two common things that can happen here are going to be when you have pain, again, going at that 90-degree mark. So 90 degrees, they usually can't, you start to have pain there. Or if you go here, and let's say one of the things you can do is take a filled water bottle that's pretty heavy, and then you'll start on your side here, and you can lift it straight up at a 45-degree angle here. If you have trouble with this motion right in here, and it feels really heavy, that can be a sign of a supraspinatus injury. The last example I saw of this was someone had a Tupperware container full of food, and they tried to hand it off with their hand, and so they're handing it off, and holding it right here is actually, it may hurt them, or they'll feel like they're really weak in this spot. And so in this instance, I had someone hand me like a Tupperware container, and they were like, this is really heavy, and I grab it and it was actually super light. And it's because they have weakness with the rotator cuff here, and it could be because there's a supraspinatus problem. There's other rotator cuff muscles that can also be damaged, but again, statistically, supraspinatus is going to be the big one, and that has pain here, weakness coming up, pain at that 90-degree mark, and then the other really common symptom that people have is pain, like shoulder pain at night, especially when they're lying on their shoulder. So if this is the shoulder that's injured, if Dr. Sabo were to go and lay on his left side, he would probably have some shoulder pain, and that could be from a supraspinatus problem or from an AC joint problem because the joint's being compressed. Shoulder pain at night when you're trying to lay down, even if you're laying on your back or you have to prop yourself up, all of those are signs that there's probably a rotator cuff injury there. So that's going to be shoulder pain for the outside here. And then the last one is going to be shoulder pain in the back of the shoulder. In this case, if you have pain in the back, it usually goes down this way. And this is going to be a problem with either arthritis, so you have cartilage damage inside the ball and socket joint of the shoulder, or it's going to be an issue with your labrum, where the labrum's a piece of tissue that sits, if you think of like a golf ball and a tee, it sits at the edge of the tee, and the golf ball and tee are synonymous with the ball and socket joint of your shoulder. So if you have a labral tear or arthritis, you can have pain back here. Another common one would be like frozen shoulder, where someone is starting to have stiffness in their shoulder, and it's because the capsule itself is tightening, and and they're unable to move at that point, or they can have restricted movement. So when you have those things, usually you have pain here in the back. Sometimes with frozen shoulder, you'll also have a issue here on the side too. A lot of people have both of those here. And so those are all things to look at. Another symptom that's really important for people to understand is going to be if you're having pain up here, kind of between the shoulder and the neck. Usually with shoulder pain, if you're having significant shoulder pain, you get a lot of muscle tension through here. So this muscle tension will go away as you fix the problem with the shoulder. But if you don't fix that, a lot of people will get massage, all that stuff here, and it won't go away until their shoulder's actually fixed. It's a compensation mechanism. We won't go into all that, but that's one thing to look at. And then shoulder pain can also be coming from the neck itself. So this is one thing. If you're dealing with shoulder pain, you want to make sure that the doctor that you're seeing is also checking to make sure that the nerves in the neck aren't causing this pain. We have a lot of, we've seen it and we've been guilty of it. That's why we know how to look for it. Where if someone comes in with shoulder pain, we automatically assume that the issue is actually at the shoulder, and we want to go and do our due diligence and make sure that the pain isn't actually coming from the neck and they feel it in the shoulder. So you want to make sure you're getting that checked out, because we've had patients come to us who are misdiagnosed, and then we've also had a handful of patients where we missed that initially because we didn't do our due diligence on it, and so we've really tightened up that process to make sure that we catch that more frequently now. And so those are some really important things to consider for this. So those are the main causes of shoulder pain in the front, the side, and the back, with the compensation mechanism that we talked about in the neck and the trap. Again, there's other things that can cause shoulder pain at the end of the day. These are just what statistically we see to be the most common here. If none of those sound like your pain, then you likely have either a number of things going on or something that we didn't discuss here. So you'll want to go and get that checked out. One thing to pay attention to is when you're looking at getting these treated, at the end of the day, the things that we discussed are all some sort of tissue damage. Most people have the objective of, one, get out of pain, but then two, if you don't want this to come back, then you really need to work with someone that's going to help educate you on the mechanics that actually caused that tissue damage in the first place. So as you're moving, you might be doing a pattern that's not supposed to be, like you might be moving in a certain way that your body isn't designed to. And if you're doing that over a long period of time, it can actually cause the issues that we discussed. And so treating the tissue damage is one component of it, and then to stop it from coming back is going to be the second component. And so anytime we have a patient in our office, we really want to answer 3 questions. Where's the pain coming from? 2, how do we treat it? And then 3, how do we stop it from coming back? A lot of doctors will give the answer of just go and stop being active and you don't have the pain anymore. Well, we don't believe in that here. So we want to make sure that we're going and giving you the ability to stay active and making sure that we can work you through each step to make sure that you get back to being that and you're able to be active again successfully. Thanks for watching.